We want to start by announcing the launch of a year-long campaign to warn Alabamians about the exploding fentanyl crisis and to provide some information about resources that can be of help. That campaign is Odds on Alabama. Such a problem, it's the different potency. Fentanyl is 50 times more potent than heroin and 100 times more potent than morphine. So the effect of that is it literally takes a few grains of fentanyl to be a lethal dose, whereas it takes obviously a much larger quantity of heroin or morphine. The way fentanyl is being laced with other illicit drugs is causing far too many deaths and long-term repercussions. The U.S. Drug Enforcement Agency found that of the illegal drugs tested for fentanyl, 60% contained a lethal dose. One of our primary messages is that if you don't get a medication from a legitimate healthcare provider or pharmacy, the odds are it could well be laced with fentanyl and perhaps even a lethal dose.
Rarely does a day go by that we don't see at least one or more fentanyl overdoses. And unfortunately, we see several deaths per week from overdose. There are multiple things that folks take on the streets: methamphetamines, cocaine, heroin, but by far the biggest problem is the fentanyl. The drug dealers realize that they can use a minute amount of fentanyl and mix it with their cocaine, and the person gets just as high. But unfortunately, these minute amounts are not easy to measure, and they can get lethal doses. As you heard just a few minutes ago, many of the drug samples that have been tested have lethal doses of fentanyl in them. And we think it's always the drug addicts that are doing this and dying, and that's the case in many situations because the drug addicts take a bunch of this and they overdose. But unfortunately, someone who is naive to taking these and they get a little sample of this or a pill from one of their friends can end up dying just with one single dose of this. And even though we'd like to think our family, our friends, our kids, our grandkids are all safe, if they're out mixing with these people and sampling these drugs, they're not safe at all. And like I say, it only takes one time with many of these people who are naive to narcotics to die. And again, it's a huge problem because we all deal with it. It all costs us a lot of money to cover the things that go on. And we do have resources available. When we see a patient in the emergency room and we're discharging them after an overdose, they all have resources given to them to be able to get help if they want it. Unfortunately, I'd say probably 90% of them just go on their way and we see them again, and sometimes we see them back dead. So again, I think this is a very valuable program to try to make everybody aware of what a serious problem fentanyl is, and it's in all our communities all over the state. When I talk with my cohorts from other hospitals and other emergency departments, everybody, everywhere you talk to them about, are seeing the same sort of thing. So I think this is going to be a very valuable program to help stem some of the use of illicit drugs and fentanyl. Thank you.
I'm Lauren Littlefield, and my brother's name is Chase Ray, and I'm here to share a little bit of his story. This past April in Tuscaloosa, he was being a curious 18-year-old boy and took something given to him by a coworker. He had no idea that it was laced with fentanyl, and by the time the ambulance had gotten to Chase, the damage had already been done and it was too late. My family was then left with impossible decisions to make in the hospital and are forever scarred and empty without Chase. All it took to change our lives forever was one pill, one time. I really appreciate the work everyone up here is doing. It's so important to not stop talking about how dangerous and prevalent fentanyl is, and to hopefully stop this from happening to other families.
Good afternoon. On behalf of the Alabama Department of Mental Health, we would like to thank all of our partners for this opportunity to bring awareness to a topic that has significantly impacted individuals, families, and communities. Understanding the negative consequences and long-term effects associated with illicitly manufactured fentanyl, we want to ensure individuals have the necessary information, services, and resources. As a result, we want you to be aware of resources such as the Connect Alabama Treatment Finder app. This app is available as a download on your phone to connect individuals with resources as it relates to prevention, treatment, and mental health services and resources throughout the state. Specifically, there are resources such as naloxone and fentanyl test strips. In addition, there are 24/7 supportive services that are available, such as the 988 Suicide and Crisis Lifeline that is answered at 3 of the state's crisis centers to support individuals, families, and friends, or individuals that have loved ones that are experiencing a substance use disorder crisis. In addition, you can find on the app 24/7 supportive recovery support services, such as the Recovery Organization of Support Specialists, also known as ROSS, and People Engaged in Recovery, also known as PEER, to assist individuals with obtaining and maintaining recovery. So whether it is education and awareness, seeking treatment services, and/or supporting recovery, ADMH is here to ensure the necessary supports and resources are easy to find for the citizens of Alabama. Thank you.
Good afternoon. Thank you all for being here. We really appreciate your interest in this. You see standing here a united group of people who all care very much about this issue. These are different organizations and agencies and individuals who have recognized what's going on in our state with fentanyl. Fentanyl is a plague in Alabama. Fentanyl causes deaths that are usually needless. They're often in our young people, and we all have to do something to improve this for the sake of every one of us. Please take a few minutes if you can to learn about the resources that are being promoted through this effort, how people can obtain care for mental health issues, for substance use issues, about the availability of naloxone and fentanyl test strips, about all the other resources that we have available. The clock is really ticking, and it is really important for all of us to be aware and to be involved.
As he did, I want to first start by thanking everybody behind us, the organizations that they represent, and the work that they have put in, the conference calls, the meetings, the passion that they all have about this issue. And it's a critical issue. It's a tragedy that we're having to be here today to even talk about it. But we do. We need to make the public aware of the issues that are going on with fentanyl, and how to educate our parents, how to educate our friends, and how to protect our loved ones so that it doesn't happen to anyone else. And you, as members of the media, can help with that. And that's the second group I want to thank and appreciate you for being here, helping us to get the word out, because without your assistance and your recognition of the problem, we can't be successful. We need to have conversations with our family, friends, and neighbors about this threat. We need to educate our communities about addiction. We need to support local organizations that are making a difference and are working to prevent substance abuse. On behalf of the Medical Association of the State of Alabama, we're proud to be a part of this organization, this part of this group. And again, we thank you as members of the media for partnering with us in this effort. With that, I'm going to open it up for questions, and I'm sure anybody behind me, if you've got a question.
Greatest drug concerns. Nationwide.
And again, it's a huge problem because it can get lethal doses. As you heard just a few minutes ago, many of the drug, a little sample of this or a pill from one of their friends of this. And even though we'd like to think it only takes one time with many of these people.
Perspective of emergency room physicians dealing with fentanyl.